adhere to keeping your teeth healthy. Dr. Christy Leedy from Abilene Dental is back to help us out, and we're talking about teeth erosion.
Teeth erosion.
How are you doing today?
I'm good. How are you?
Good. I'm looking at some of the pictures that we have here. It's kind of it's something different. We talked about there are lots of different decays and whatnot, but erosion can cause a lot of things.
Exactly. And erosion is more common than we think because there can be different places that erosion shows up.
Yeah.
And it's really not always even age specific, but if you can zoom in a little bit, I'll show some.
And so this is just one example.
Okay, so like we'll see erosion on the front of teeth. People that grew up eating lemons and limes, you know, it'll start wearing off the enamel there. So we'll see that quite a bit. Then we have spots like, this is a common area here, like down along the gum line. So if you clench your teeth and you eat a lot of acidic foods or you have acid reflux and those kind of things, we'll see decay and erosion down there where
but
it just wears
this is where
up
you
the
see
enamel.
the huge
Exactly.
effect.
Yeah. This one, if you can zoom in, and where the teeth almost look like little bowls, they're forming bowls where the as we talked about, a lot of times this has to do with a lot of soft drinks and energy drinks and that type of thing.
Now, how long do you have to be drinking or how often?
You know, everyone's different because we'll even see this nowadays in late teens and 20s sometimes because of the amount of soft drinks that we see teens and energy drinks and Gatorades and those kind of things. So, and if your enamel tends to be more soft or you tend to clench your teeth, you'll even break off whole slivers of tooth. And so teeth just can start shearing away because the enamel gets so weak.
Wow.
Yeah. So what do you do?
What do we do?
What do you do? Okay. Number one, if you can break some of those habits, that helps a lot. Drinking water, that helps a lot to neutralize some of the acid. Fluorides, getting your teeth cleaned regularly and checked before they get to be so worn down that you can't protect them, night guards. When they get to the point, as we've seen, then you begin to do things like covering them in porcelain. And so these are actually bonded porcelain crowns. And this shows you from now the biting surface of the teeth. Now it looks a whole lot different.
I can sleep at night.
That's exactly right. And chew better.
That's true.
And they're not sensitive. You know, so many things like that happen too. Your nutrition suffers a lot of time because of the sensitivity.
True.
And you're chewing around spots that are worn down and broken. And then if you can, so this is the before where we're talking about the slivers of teeth. This is the after with the porcelain covering. And you can also tell how her bite is taller, if you will. And what that is where you also recreate the height of the teeth on the biting surface, you know, where we saw they had worn down. So that's, this is Kathy before, and look at this. This sends you home smiling.
There you go.
Beautiful.
Beautiful. What a great way to start your summer, really continue your summer.
Exactly.
With some bright smiles. Thank you so much. Really appreciate it.
Thank you.
Again, maybe break the habits if you can.
That's exactly right.
I guess it's the number one prevention.
Exactly. Prevention and protection.
A lot of things that we can all learn a lesson from.
That's
you can make an appointment at Abilene Dental today. Just call the number on your screen or head to their offices of Buffalo Gap Road. Also, check them out on Facebook and Twitter. Just search Abilene Dental. Don't go away. We'll have more.